When I found out I was pregnant, I didn't know about the honey program. My housing situation at the time was not good. It was heading in a really bad direction. I was actually scared. My circumstances were so bad, I was scared that I was gonna have to possibly give him away for adoption. I had always wanted a son, and now I finally have him.
HONEY stands for Housing Our Newborns Empowering You. We provide perinatal care coordination and navigation services to people that are also experiencing homelessness in DC.
Navigating housing insecurity means not knowing where you're going to lay your head at night, not knowing where you'll be able to make meals for yourself and your family. That uncertainty plays a big role in the physical and mental health of women and families experiencing the joy of pregnancy. The physical impacts might be complications during their pregnancy, such as preeclampsia or hypertension. It might mean low birth weight of their baby. It may mean preterm labor for the parent. We also see depression, anxiety, and just overall stress from navigating pregnancy and homelessness at the same time.
We see late entry or sometimes even no entry to prenatal care. Our goal is basically to accompany families so they can have healthy pregnancies and births and healthy environments to bring their babies home to.
So in 2022, Community of Hope partnered with the DC Office of Health Equity and Georgetown University, as well as other local partners on the Calling All Sectors initiative, which was funded by the Robert Wood Johnson Foundation and the Pew Charitable Trust. We conducted a series of focus groups to gain a better understanding of the lived experiences of families experiencing homelessness and pregnancy. And through those focus groups, we learned that there was so much more support that they needed during that time.
I got connected with an agency called Virginia Williams Resource Center, and they actually gave a referral to the HONEY program for me.
The Virginia Williams Family Resource Center is the central intake for homeless services here in the district for families. We provide prevention services, eligibility for shelter, the Emergency Rental Assistance Program, ERAP, and also DC Flex fall under that umbrella.
Our staff are embedded at Virginia Williams to be able to receive a warm handoff from Virginia Williams and to give the family the support as soon as they express that need.
We've been able to create a program where we can touch those individuals who are homeless, who are facing housing instability, and who are pregnant to get them connected to prenatal care and case management, along with the housing case management, so we can see outcomes being better.
If someone opts into our perinatal care coordination program, so the full program, they will receive a PCC that accompanies them throughout their pregnancy until they're 6 months postpartum.
And through this program, we connect pregnant people experiencing homelessness with perinatal care, transportation to and from appointments, baby supplies, and some of the necessities that they might need when navigating the homelessness system.
And we don't want to overwhelm anyone with another thing that they have to do. And so this allows them to kind of tailor their supports like a concierge to what they need. So we've created something that we call Beyond Birth Circles. They're just like supportive groups for these families, and they can talk about anything from self-care, how to navigate co-parenting with maybe a partner that you're not with, but you want to parent with. They talk about nutrition, breastfeeding supports, things like that. The other really cool aspect of our program is that we provide training and education to health and housing providers to kind of bridge that knowledge gap so they can best support those families.
When she got assigned to me, she hit the ground feet running. Immediately was like, okay, you have this, you don't have this. What do we need to make you feel comfortable during this pregnancy and with the baby? Honestly, I don't think I would have got through majority of my pregnancy without her.
We have been a pillar of the DC community for over 40 years now, providing healthcare and housing regardless of income, insurance, or ability to pay.
They're trained in what we need for homeless prevention services. They have doctors, they have nurses, they have outreach services that are able to help this population, homeless and pregnant. That's what makes Community of Hope a great partner, great leader behind Honey.
So the data is telling us that this program is helping. It's making a big impact for the families that we serve. Over the past year and a half, we have served over 200 families navigating the homelessness continuum. We have been able to connect over 1,000 resources and community partners to our families to meet those basic needs. The low birth weight rate for Honey participants, 14.5%, was comparable to the low birth weight rates for African American non-Hispanic DC residents on Medicaid. The biggest change can be seen in preterm births. Honey participants experience preterm birth 8% of the time, while African American non-Hispanic DC residents on Medicaid experience preterm birth 15.6% of the time. We are seeing that many of our families are coming to our attention during their second and third trimester.
We also see a reduction in depression and anxiety that we typically see when other stressors are present in the pregnancy. We are seeing that people are feeling better about their pregnancies. We're able to provide all of these supports that are in place wherever they are, and that can make them feel a lot better and more secure.
We know that across the country, there are many departments of human services like ours that can be great partners to federally qualified health centers and other patient-serving organizations to meet this need.
The number one thing is having that mindset and being creative to be able to implement a program. The key thing is having those providers that are willing to work together to ensure long-term outcomes that are positive for this population.
They did a really good job, and it needs to, the program itself should have more awareness and should be more widespread than just here in Washington, D.C. Community of Hope has been a big part of my family for 6 years now, and now a year almost now with the Honey program.
Community of Hope empowers not just individuals, but families.
Having such a strong team and having built such trust in our community, we don't take that trust for granted. So I'm glad that we are able to make this impact in an innovative and integrated way.
I wish the program was longer because I am still getting a lot out of it. I would stay here forever if I could, yeah.